Welcome back to the deep dive. Today we're taking a close look at some revision notes,
Hmm.
specifically focusing on a really common finding in newborns, the mission. Distill this into a clear, high-yield summary for you.
Exactly. We're diving into Epstein's pearls in newborns. Sounds a bit formal,
Like
maybe?
a little bit, yeah.
But you'll see as we unpack these notes, it's actually pretty straightforward, nothing complex.
Okay, let's get straight into it then. What exactly are Epstein's pearls, according to these sources? What do they look like?
Right. So the notes define them pretty clearly. They're small,
Yeah.
benign, white, or maybe yellowish bumps.
How small?
We're talking tiny, typically 1 to 3 millimeters across, and you find them on the newborn's gums or, the roof of their mouth.
Okay,
The really crucial points the sources make are common, completely harmless, and importantly, painless for the baby.
right. Painless. And thinking about where to look, where exactly do the notes suggest?
Primarily, the focus is on the hard palate.
The hard palate, so
Yeah.
the front part of the roof of the mouth.
That's the one, the bony part. But the notes also mention they can show up on the gums.
Ah, okay.
And that gum location is interesting because, well, that's where they might look a bit like an early tooth coming through.
I see. So knowing what they look like and where they pop up, let's talk about the why. What actually causes these little bumps?
Yeah, this is where the developmental side comes in. It's actually quite interesting. The
Mhm.
sources explain they're basically a developmental thing. It happens when little bits of epithelial cells get trapped.
Trapped, like skin cells.
Sort of, yeah, like the
Oh.
cells lining the mouth, they get trapped while the baby's mouth and gums are forming, in utero.
Okay.
And these trapped cells form tiny cysts filled with keratin. That's a protein like in skin and hair.
Right.
So those little keratin-filled cysts, those are the Epstein's pearls.
Ah, okay. So it's literally just bits getting kind of stuck during development. Makes sense.
Pretty much, yeah.
Do the notes mention anything about risk factors? Like, is anything likely to make a baby more prone to getting them?
Well, what's interesting here, and the sources are very clear on this,
Yeah.
there are no specific risk factors linked to Epstein's pearls.
Really? None at all?
Nope. They're just common, globally common in newborns. The notes we have mention that specific UK prevalence isn't detailed in this material, but the big picture is you see them a lot.
Okay, so super common. Given that, how would you spot them clinically, and maybe more importantly, what else could they be? What's the differential?
So, like we said, they look like those small white or yellowish bumps. The absolute key thing, and the notes really stress this, is that they are painless. They don't cause the baby any bother at all.
Right, that's crucial.
Absolutely vital for telling them apart, because the sources list a few lookalikes. The main one is probably natal teeth, actual teeth a baby's born with.
Okay.
The list also mentions Mons nodules. They look similar, but are usually more in the gums or the alveolar ridges.
Right.
Then there are dental lamina cysts, another type of small keratin cyst. And, much less likely, but technically possible, things like dental plaque or other oral lesions, but they'd probably look and feel quite different.
Got it. So you see one of these little painless white bumps.
Hmm.
What do the sources say you should actually do? Any tests? Any treatment?
Good question. And thankfully, the answer from the notes is pretty simple.
Okay.
Diagnosis is basically clinical, just by looking.
Mm-hmm.
No extra tests or investigations are usually needed.
And management.
Well, there's no specific treatment needed, none at all, because they're harmless, and the key thing is they self-resolve.
Spontaneous resolution. That sounds like the main message here.
Exactly. They almost always disappear on their own, usually within a few weeks, maybe a couple of months.
As the mouth develops?
Yeah, as the normal mouth structures grow and shed cells. The only advice mentioned is just general good oral hygiene.
Which for a newborn means?
Just gently wiping the inside of the mouth with a clean, damp cloth. Standard care, really.
Okay.
Sure.
So putting it all together, what does this mean for the baby long term? Any worries down the line?
The prognosis is excellent, absolutely excellent. They are benign, so not harmful, not cancerous and self-limiting. They just go away.
No complication.
The sources are really explicit. There are no complications tied to Epstein's pearls, and absolutely no long-term risks for the baby's oral health or, future tooth development.
Wow. Okay. That's a really thorough look at something so small.
So
So the big takeaway seems to be totally normal, super common, look like tiny, painless white or yellow bumps, often on a palate or gums,
right.
caused by trapped developmental tissue, and they just vanish on their own. No fuss.
Exactly. And if you think about the bigger picture, it's a great example, isn't it? Of all the normal self-resolving variations you see in newborns that really don't need any intervention.
It really is. A proper deep dive into a tiny detail, but really essential knowledge to have. So maybe something for you to think about. How does understanding these normal variations, like Epstein's pearls, actually help build your confidence in spotting the things that do genuinely need attention?
That's a great point. And for anyone wanting more high-yield revision resources like these notes we've discussed,
Yep.
you can find more at pastthemsra.com and also at freemsra.com.
Perfect. Well, we hope this deep dive was useful for you. See you next time.